is, if we are talking about someone is brain dead, how do you deal with their parents, or what can you offer? Okay, so criteria is capable of causing neurological death with unresponsive trauma and motor responses. Absent bilaterally, spinal reflexes may be present. Okay, now comes the main reflexes that you have to check. Okay, so brain stem reflex, gag reflex, cuff response, corneal response, pupillary response with the pupils mid-size or the large, or the vestibular ocular response must be absent bilaterally. These are very important reflexes. You have to remember them on your fingertips. In these reflexes, if we are looking for, they should be bilateral and they should be absent, it will definitely declare as a brain dead. No respiratory effort by apnea test. Okay. All tests must be performed in absence of the confounding factors, for example, shock, hypothermia, stroke, metabolic symptoms, muscular, or the drug effects. So it has to be, everything has to be ruled out, then go for this. So basically, if they ask, okay, a person comes to, he had a accident and he came to the hospital and you are suspicious of brain dead, what is the reflexes that you will check? Okay. Now this says that the person came and then he had a surgery, sorry, accident, and he came and his brain stem reflex is absent and his cuff response is absent, corneal response is absent, pupillary response is absent, but mild gag reflex is present. So in that case, it's still not brain death, although it is brain death, but you cannot label it. So now we are still confused because, here we are talking about a brain death person. So in that case is consulting with your supervisor. Okay? Consulting with supervisor will be the best answer instead of declaring. Okay. Then comes another person where they says brain death, stem reflex is present, gag reflex is absent. Sorry, brain stem reflex is absent, gag reflex is absent, cuff reflex is absent, spinal reflex is absent, corneal reflex, but mild pupillary response is present, and this is bilaterally present. So in that case, is contacting your supervisor so they can come and do it. Okay. So usually for the brain death, two people should do the same reflexes and find out if they are not there. So then we can declare them brain death 100%. Okay, but they did not mention it here. So in the bookish point of view, even one person do the reflexes, then it is basically more than enough to tell them that he's brain dead. All functions must be respond in the absence of the confounding, and then in confounding are present, perform the cerebral angiography or the perfusion scintigraphy. Okay. So these are all the reflexes that you have to remember on that. And they can directly ask you what are the reflexes that you will look into. Then comes the Aboriginal health, discuss what they want to. So I think I did not discuss about how will you deal with the patient. I think we already did give you a little bit of an idea. So bereavement counseling, offering the organ donor, there is a organ donation and all that. If the patient has organ donation cards, so in that case we can offer those ones thing too. Discuss what they want to avoid in treatment, and then before removing them from the ventilator, you have to give some their parents or their family members to spend some time with the patient. Aboriginal has discussed what they want to avoid in the treatment. If requesting smoking ceremony, you can say no because of the smoking hazards, but provide alternatives such as performing it outside. Leading cause of the death is suicide. Diabetes is the most prevalent amongst the indigenous and due to social suffering, and then genetic predisposing. Never choose to say no to them, no matter what the request is. Okay. So we always try to say in the different ways. If request is unreasonable, give them alternatives and never just deny the request, because then they can get aggressive, they won't listen. So these are some consequences. So you don't have to say no to them. Always give them alternatives. Even I wouldn't suggest only to Aboriginals, even for the other people. In your ethics, you should be like, a person who should be like an angel. Like, I know it's kind of funny, but yeah, like an angel. Never ever try to say no. Never ever try to be aggressive. Never ever try. Always try to look for an alternatives and what's best for the patient, what they are looking for. Okay. So I recently saw a patient. She was having smoke. She was trying to quit smoking. Okay. And she tried nicotine patches, nicotine gums, and inhalers and everything. Nothing is working out for her, and she's so depressed. And she said, "I don't know what to do." So in that case, then she wanted to do is basically uh, like uh, her request was like, asking for her to join our therapy sessions where she can do like a psychiatrist referral, and psychiatrist can write on the therapy session because she cannot afford the therapy session. I told her this is not something like for smoking. Why would I refer to a psychiatrist? Like that does not make sense anyway. Then I told her, okay, there is another options, like maybe we can start Verniclean. Okay, that is also something that helps with the craving of the smoking. So how about you try this one? Come back in 2 weeks and see how it's working for you. So I told her the mechanism of how it works. Now she was what her main concern was. She wanted to stop smoking or she wanted to quit smoking. I gave her an alternative to a psychiatrist referral by giving another medication to use for the smoking. So I addressed her concern, but giving her an alternative, and she was willing to start it. So, I did not say no. I did not say, a referral is a bad choice. Why should I do it? It's going to take a long, whatever it is. I said, how about we try this? And if it did not work out, we do have another options. We can start those ones. So she was willing to listen. So, try to work on your counseling a lot. Whenever you try, even in your conversations, when you are talking to your friends and stuff, always try to learn how to say no to, like how to choose to say no to them, like how to avoid no to them. So it will help you a lot. Like, it will help you to figure out which situations you can deal with what. And in that cases, you will be a more better family physician in ethics point of view. Then comes the continued medical education activities, such as seminars can be funded by the companies but cannot be advertised, identify the products of the patients. Funding should be in the form of the grant to the medical institution. Use generic names along with the trader's name when mentioning the patient in CME. Then comes the company alternatives. Representatives cannot take part in the CME. Uh, the physicians should not engage in peer selling, and then peer selling all occurs when the pharmaceutical or the medical device manufacturer or the service provider engages a physician to conduct a seminar or similar event that focuses on its own product. So like talking about only trazotririne, and then just focusing on those things, and trying to sell it more and more just to get the money, it does not work. So if specific products or the services are mentioned, they should be mentioned with the specific information like, oh, this can cause this is this. So that's why. Faculty of CME events may accept a reasonable, honorable, and then reimbursement for the travel lodging. Because if I am going let's suppose if I am working in Manitoba and someone CME events are asking me come and participate in Toronto, right? I am going there on behalf of my whole team, but my travel, lodging, meal expenses should be covered. But if other than that, I'm asking them, pay for my visa to UK, then that does not make sense. That's not the right thing. Attendees cannot be reimbursed. So doctors can accept the samples but must record the amount. Doctors cannot accept the gifts. Doctor can accept the teaching aids like, like sutures and all those. Duties of the physician will regard to the, okay, so I just recently saw, like today, there was a patient who has a injury to his hand, and he got a like a really deep injury and he needs sutures. So what happened is he went to a different clinic. That clinic, they did not want to do the suture, so they referred that patient to us, and I'm able to do the suture. So in that regards, even if it's a injury, you can do bandage and refer that patient. So something like this can be referred as well. Even it's an injury, it's a great deep injury, you do this bandage and then refer that patient. Duties of the physician with regard to the privacy of the health information: obtain the patient's express consent to disclose information to the third parties. Patient express consent need not to be obtained to share the information between healthcare team involved in the circle of care. So we already talk about the lockbox. The patient may withdraw consent from his sharing and may put part of the chart in a lockbox. Like, you are a family physician, you know that patient has HIV, and the patient said, I don't want to disclose my HIV. And then circle of care includes a surgeon, like a some kind of surgeon, nurses, all of those ones. And he said, I don't want to do it. So you will not disclose HIV. Okay. Although it has a risk of, spreading and everything, but in our practice, we do try our best to not get in touch with anything that can be cause HIV to any other person, right? So even if you hide it, it is not something that can be transmittable or something like those ones. Okay, but although this says HIV is communicable disease, it should be reported and all that. But here he specifically mentioned the lockbox part where the share of information may put into the lockbox. So when he specifically say HIV, then it should be kept confidential because physicians are going to practice all those cleaning things, regardless of HIV or no HIV to prevent spreading of HIV. Okay. So circle of care is the group of healthcare providers treating a patients who need information to provide the care. For example, if the physician refers patient to psychiatrist, both family physician and psychiatrist are a part of care and consent is not required to share information between the two. So then comes the log boxes. The log boxes is applies to the patients where the patient has expressed restricted their physician from disclosing information aspect of their healthcare information to others, even though involved in the patient circle of care. Note that the patient's personal health information FIA Act is provisional donate. So please remember this word FIFA Act. Basically, it's called FIA Act. Then provision donates that the patient may not prevent physicians from dislocation of the personal health information permitted required by the law. So usually in circle of care, when they sign this FIA, they don't allow this lockbox or whatever because it needs to be shared. So when you sign this FIA contact, it says that the lockbox and everything will not be excluded, will be excluded. So patients may not prevent. So it will be written there that patients whatever information should be shared within circle of care, and he should not prevent the physician to share the information. Okay, so if someone has signed the FIA, it means his information can be shared. What is breach of confidentiality? Sorry, when is breach of confidentiality allowed? Risk of substantial harm to others or to the patients themselves, then include the communicable disease. All communicable diseases like HIV status can be revealed to the sexual partner, but first talk to the patient and try to convince them to disclose the status at a time limit. If does not comply, then inform the contacts. Duty to warn, so patient confides the plan to harm someone, clear risk to identifiable persons, risk of the serious injury, harm, or the death, and then danger is imminent, so it can happen. Like I'm just going to go right away and kill that person. So in that cases, it needs to be, child abuse, mandatory to report, fitness to drive, definitely you have to tell, and then coroner report. Death notification, when to notify the coroner, violence, negligence, misconduct, sudden unexpected death, disease not treated. So it can be, okay, someone was in the like in gangrenous and then in the hospital admitted for too long and he was not getting proper antibiotics. So in that case, if coroner did a post-mortem and find out that he's not getting antibiotics for a prolonged period of time and his disease got spread out and he just died. So in that case, it also need to be notified. Can cause other diseases and suspicious circumstances. So even in suspicious circumstances, a coroner can break the confidentiality. Manage of the suicidal patients. Least restrictive alternatives, discharge patient with a follow-up if sportive supervision present and there is low risk of self-harm, voluntary hospitalization if relatively clear suicidal plan, drinks a lot and is socially isolated. In that cases, you have to do that. And involuntary hospitalization, you have to do that one. Then comes the abortion. Abortion is legal. Elective is legal. Second and third trimester option is also legal. Okay, but usually also only carried out if there is a serious risk of the woman health or the fetus has the major malformations like anencephaly and all that. Abortion is incompetent woman. Abortion can be induced by authority or the guardian only if it is therapeutic. So it is an incompetent woman where they don't know, or the female is schizophrenia mania and you don't like she's incompetent. In that case it can be induced by the authority of the guardian only if it's therapeutic. Now disclosure, all harmful incident must be disclosed to the patient. No harm incident. Now comes the different points. I hope you guys have read it somewhere before too. So no harm incident, a patient safety incident that reached the patient but not discriminately harm the resulted. Wrong medication given to the patient but did not affect the patient. Okay. So now what happened is wrong medication entered the body So it means the harm has been done but did not cause any incident, so did not cause any problem. In that cases, you have to inform, because it, like, I'll just give you a scenario where this says the wrong medication was about to enter and a nurse checked and stopped. Now nothing happened, not even the medication did not even entered. So in that cases, you can hold, but you can still see, like, I think near miss is coming. It needs to be disclosed to the patient. So no near miss is a patient safety incident that did not reach the patient and therefore no harm resulted. So wrong limb prepped for the surgery, but surgery noticed it in the file and did not operate it. It does not need to be disclosed to the patient, but again, now did when you already prep and everything is done, patient will be able to know and stuff like that. Okay. And if patient is asking, then it means you have to disclose. But otherwise, nothing happened. The medication did not enter the body. Wrong limb was prepped, but did not cut or did not, start the surgery or did not do anything. So it does not need to be excluded, because not even the harm happened, not even the incident happened. Now come the disclosure of the trainee competency. Recent graduates need to disclose their qualifications to patients in order to obtain the consent for the treatment. So you have to tell them, oh, I'm a resident, I just started my whatever thing, or I'm a resident for 2 years, I have done participated in many surgeries before, and I'm very competent and all those things. So you have to tell them. The graduates can cite the experience of the team to reassure the patient, like I have participated 5 to 10 surgeries before, so then attending should inform the patients of all level of the involvement of the residents doing fully and part of surgery. So that one is. Then comes the cannabis prescription. Doctors cannot prescribe cannabis to the patient before 25 years unless all the conventional treatment has been failed, and in that cases you can go for the herbal cannabis, you can give them. Taking blood samples for alcohol and marijuana testing cannot be taken without the patient consent, even if you are asked by a police, can be taken without consent if the warrant is issued. So in that case, you can go. Organ donation. So after brain death, not made, yeah, after brain death. So if the patient wanted to donate organs, but the patient family does not agree, but the doctor is not obliged to take permission from the family, it is ethical to discuss with the family first. But family is not willing, then and the person wants to do it, then go for it. Contraindication to the organ donation when it is HIV or active cancer. Can donate if cured. Vaccination if vaccination is necessary to preserve the life of the child, but parents refuse, call the CAS. Okay. Then the elder abuse is mandatory reporting if patient resides in the long-term home, cannot give any information to the police without consent or the warrant. So you can report them, but at the same time, if police comes and asking for, okay, what is going on and all that, so you cannot give them. Age of consent for the sexual activity, majority age is 18 years. Partners cannot be in the position of the authority like football coach or supervisors or anything. Age of the consent of exfoliative activity, 18 years. 14 to 15 year can be sexual relationship with a person less than 5 years older than them. 12 to 13 for them, it's basically 2 years older than them, less than 2 years older than them. And then consent during surgery. If surgeon decides to perform an extra procedure or step during the surgery for which expressed and written consent was not obtained beforehand, it is important to assess it is an emergency. Emergency cannot consent cannot required. So like hysterectomy due to unprolonged PPH during C-section, because now he can die. Not emergency, wait till the patient wakes up and takes consent. Okay. Then substitute decision maker hierarchy. The first of all is court appointed, power of attorney, then the spouse, child more than 16-year or parents, assessed parents, siblings, and other relatives. Then comes the family dispute for the treatment of the member. It's a very important question in ethics, in NAC point of view as well. Elderly, obtain the help from the ethics committee. In that case, is because it's better to contact the ethics committee, because sometimes STNs and all of them are also making a lot of problems. So in that case, children arguing about the treatment of the elderly, mother, children are at the same level of STM hierarchy and so cannot choose. So in that case, is going for the ethics committee. So they did not say talk to supervisor. They did not say hospital committee. It directly says ethics committee. Okay. Children, both parents permission required if they are married. If the doctor does not agree with the decision of STM, contact the case. In case of any dispute, always choose to first discuss, mediate, and then go to ethics committee. Again, discuss, bringing them at the same level, asking them for a family meeting, mediate, and still cannot make any decision, so go for ethics committee. Exception to the truth counseling when the information can be withheld from the patient. Waiving of right, patient can waive off right to information. Doctors should still take the consent, document all information. Like, patient said, oh, I don't want to know anything. Even after doing the pap test, he does not want to know what is the result of the pap test. So in that case, is obviously you don't need to tell them, but still you have to tell them if you are going for any cytology or another testing for that one. But you have to document. I keep telling you, you will only justify yourself with the documentation. Strong cultural competent component, no effect on patient, so it's not going to affect anything. If it's like we did pap test is normal, and now he needs to do it every 3 years. So something normal results, we don't tell to the patient, we just let them know. If no news means good news, okay. Patient may ask others to be informed. In that cases, you can tell them. Therapeutic privilege, withhold of information by the clinicians in the belief that the disclosure of the information can affect, cause anxiety, psychological and physical harm to the patient. Request for the induction delayed labor can be done if the fetus is not at risk. If request is due to unreasonable belief, God wants the baby to come, send to psychiatry. Okay. Women can refuse the induction or the delay of the labor even if the fetus is suffering, because now fetus is still in the body. Fetus has no rights. Mother has the rights. Then comes the legal issues during pregnancy. If a mother is competent and refuses medical advice, her decision must be respected, even if the fetus will suffer. The fetus does not have the legal rights until it is born alive. The complete delivery from the body of the woman. A pregnant woman that is addictive of the teratogenic substances cannot be detained or treated to protect the fetus. So in that case, you don't have to do, because I told you fetus is still in the baby. You don't have to in the belly. He does not have right. A mother is permitted to refuse HIV treatment during pregnancy, even if it's vertical transmission to the fetus. Mother is permitted to refuse a cesarean section, even if it's causing fetal distress. Exception to consent. When do you need to not take the consent? Did you see how everything's easily compiled for you? You don't need to go into very different things to look for stuff like that. So it's a very straightforward thing that can help you to solve. Again, if you are doubtful about any kind of ethics question, go to CMP and you can type your question and they can answer your questions right away. Okay? Any kind of question can be checked on the CMPA. Exception to the consent where the emergencies is, like type of incapable unconscious person in the emergency, where without the treatment patient is a risk to harm, like I told you, disable and all that. Communicable diseases, there you have to, there is no need to do the consent. Legislation, mental health legislation allows for the detention of the patient without their consent. So you have to hold that, because if they go home, they will try to kill themselves or stuff like that. Public health legislation allows the medical officers of health to detain, examine, and treat patients without their consent to prevent the transmission of the communicable disease like TB. If TB is something that, even chicken pox or the droplet infections, in that cases, if someone does not even want to get the treatment, so you have to hold, detain, and treat the patient. Treatment without the consent, so basically battery, include if no consent or if the wrong procedure. Treatment with the poor and invalid consent is negligence. So they're talking about treatment without consent is basically called battery, including if no consent or if the wrong procedure. So it can be anything, like, you told them to do a appendectomy and then now you're doing something else. Treatment with the poor or invalid consent is basically negligence. So now comes the notes. The most important notes, what are those ones? Like tidbits. Psychiatric patients can be involuntary detained if risk of harm or to self or others, incapable of the self-care. Patients and risk advisor should be notified if being detained involuntarily. Non-treatment of the neonates born alive is acceptable in 22 less than 22 years old, 22 to 25, and then discuss with the patient with more than 25. So in that cases, Then comes the patient can refuse the HIV treatment, although mandatory treatment testing in prison, and then the military one. Patients may have a personal relationship with the patients. Sorry, physician. Physicians may have a personal relationship with the patients if more than 1 year since last therapeutic contact, except psychotherapy permanently prohibited. Okay. Then physicians can't treat themselves or the family members except for minor conditions or in the emergencies, and only if no other physician is readily available. Court declare the competency, physician assess the capacity. So how do you check the capacity? Capacity is the ability to understand the information relevant to a treatment decision making, appreciate the reasonable foreseeable consequences of decision or lack of decision. Sub apnea, what is sub apnea? It is also a command to attend the court, cannot be compelled to breach confidentiality. Witness is doctors can get attendance money as an expert witness. So, if someone is asking me, like let's suppose just I recently saw a case where the patient was got exposed to lead poisoning. So he was staying in building where there was lead in that building. Okay, but the owner of the house did not tell them. So in that cases he was exposed to the lead and he was getting the treatment for that one. So in that cases, if court asked me to come and tell that the consequences of treatment of the lead poisoning, was it there, not there, so I can come and I can just pay for that one. Okay, so that's about it. I mean, I hope you guys don't have any question from here.